So this month we are helping you get on top of your health care. Right now it is open enrollment for Medicare, and Jeff Walker with the Rover Agency is here to talk about it. Jeff, welcome to the show.
Thank you.
So this is a big and busy time for you. A lot of people have questions about this.
Yes.
What are some of the most important questions, the top, questions that you get asked that people want to know?
Well, there's a lot of confusion when it comes to Medicare. The biggest thing that I want everyone to understand is that the open enrollment period, we're in it now. It started October 5th.
Yeah.
It goes until December 7th. And it really does affect every single individual on Medicare.
Wow.
Yeah, they do need to speak with an agent and not speak with their neighbors or even their doctors, and speak with an agent who understands and can help them to understand their situation and find out what changes, if any, need to be made. Because
things are different for different people, because your circumstances should dictate exactly the choices you make, and that doesn't mean, you're not going to do the same thing your neighbor might do. So that's a very important point. All right, what are the big changes that are coming this year?
There really isn't big changes.
Okay.
Really, this open enrollment period, like I said, it does affect everyone, and it goes along the lines of their drug plan. So there's two different ways of being covered. You can have the original Medicare with a Medicare supplement or a Medigap policy, and then you would have a separate drug plan that covers your prescription, does not affect that. Or you have a Part C known as Medicare Advantage that includes the prescription coverage. So during this time, this is the only time that you can make those changes. They go into effect the 1st of January, and they go for that entire year.
So this is it, and you have to live with whatever decision you make or don't make.
Right.
And if you don't make a decision, what happens?
You're with the plan that you had previous. So for instance, if you did not make a change during this open enrollment period as of December 8th, you're going to have the plan that you chose for 2014. Now things will change. The cost of drugs will change, the plans, the way that they cover those drugs will change, your premiums will change, you may want to go to a different pharmacy, or you may have gotten prescribed something in June that you weren't taking back in the open enrollment the year before. So the biggest thing that I want people to understand is that you need to speak with a trusted advisor that understands how Medicare works and can walk you through individually on what you should do, because it can't be something that you do because everybody else did it.
So where can we find this trusted representative to walk us through our situation and the options for us?
That's the stick. I mean, you're gonna get mailings from folks like myself. We're gonna call you. We're gonna send you mailings. We simply want to talk to you. And when I say a trusted advisor, you do want to know someone and find someone that understands it and can then relay those situations to you and your situation. And that's why I say you don't want to ask your neighbor. You definitely don't want to ask the pharmacist or your doctor, because you're not going to come to me and ask me what kind of medication to take for a stomach ache. You're going to talk to your doctor. And in that same lines, you want to talk to an advisor on Medicare insurance on what you should do for your Medicare needs. Fit it within your budget, find out, what do you want, things of that nature.
Jeff, thanks so much with the Rover Agency for coming and for sharing this with us. Good information, really helping to shed light on some misconceptions about Medicare.
Thank you. I appreciate the time.
Absolutely.